Hi, everyone. Gil Fried again, the crowd management doctor, and welcome to another installment of one of our exciting videos where we get to talk with someone who works in the industry and is on the front lines. And today, our guest is Dr. Andrew Milstein. Andrew, why don't you give me a brief overview of your background so the people that are listening will know that they should trust you, trust the doctor.
Well, hi, Gil. Thanks for having me. I really appreciate it. I've watched your videos, really like them, and I'm glad they're so informative. So I'm an ER doctor, and I basically was in school in DC. Then I went to residency in New York City, where I got really involved in EMS. Worked a lot with the New York City Fire Department, um, and really got to see what EMS was about. I didn't really know anything about event medicine at that time, but I got into EMS and a little bit of disaster medicine. And then after I finished my residency in New York City, I did a special fellowship, which is a 2 year training for physicians where you can focus on a specialty. So I focused on EMS, fire departments, and then while I was there, I sort of went into public health, disaster medicine, and especially event medicine, because I was at University of Maryland, and they had a contract with I'm going to say the Ravens Stadium. I know it has an official sponsor, but it was Ravens Stadium and Orioles Camden Yards. So I got to be the medical director for the Ravens Stadium, and for fan operations, not for the players. And then I did a lot of work at Camden Yards as well. Um, so I really got into it there, and then from that we sort of branched and did a lot of with the Baltimore Marathon, and then so I did that for about 9 years, and then recently, in 2009, I came up to Massachusetts, and I've been with University of Massachusetts in the EMS and disaster medicine division since then. And we don't do as much as work, but we're in Worcester, which is central Massachusetts, and we do event sort of summer events in central Massachusetts and Worcester. Like the summertime, they have outdoor events, and we manage those.
Okay. What got you interested in this side of medicine? I mean, there's so many other things people could go into focusing in on uh, obstetrician work or orthopedics or this or that. What got you interested in this area?
Well, I really it's a good question. Really I enjoyed emergency medicine work, so I really like working in the ER, seeing people as they come in and helping them and diagnosing and treating. But then I also liked what I really liked about EMS and event and disaster medicine is you sort of do it's kind of ER work, but outside of the hospital. Um, it's really you get to do administration, management, hands-on patient care, working with all kinds of people that you don't get to work with in the ER, such as EMS, fire, police, VIP. You do contract negotiations, all this whole world of other kind of really interesting stuff that's sort of peripheral to ER, but kind of related to it.
Okay.
Yeah, and also you get to sort of do interesting research with large volumes of people. Some of the work we did at University of Maryland, we would look at that large number of people that went to the stadiums, and we said, well, how can we make their experience better? How can we, what happens that can make them safer, and sort of try to do research in that area.
Okay. Because you've had, as you said, like 9 years experience doing that kind of work in Baltimore, what war stories can you give us that might
Yeah,
interest our
yeah.
viewers?
Well, back in the day, as we say. So really, there was a radio station back in Maryland called WHFS, which was the alternative music station, and they had a day-long concert every summer that was packed to the gills. And so 1999, we did another one of these events, and this was all sort of pre-cell phones. Now it's a little bit different, but back then, we that day was very hot, and as usual, this is open. It's open seating, so everybody is in front of the stage. It's hot. It's packed. They had put tarp down to protect the field, um, So everybody's standing on a black tarp in the middle of a hot summer day, overheating, because you get that sort of overheating effect. Um, and they're trying to spray them down with water. But we must have treated like at least 800 people that day, just constantly coming back into the first aid station, like passing out or mosh pit injuries or crowd surfing injuries. Um, and then nobody could get a hold of there was no way to get a hold of parents. I mean, a lot of these people were like teenagers. Um, so we had that was the biggest war story, was trying to find all the parents and figure out, and then people would call, where'd my son go? And you're like, well, they went to this hospital, hospital A or hospital B, and trying to keep track of where everybody went was a huge nightmare.
So
That was the
it's
biggest, yeah.
technology has really made an impact, for the good and for the bad. But that would
Right.
be a good side of things. Any other war stories that you can think of?
Um, well, we've done some marathons where we've had some, we really rely on a really good communication network, and not just by the pre-hospital providers and physicians, but all of the work, like at Camden Yards and especially Raven Stadium. Everybody who would work would have a radio, even if you're the usher, um, you're any kind of public safety. Now, you're not the guys handing out, you're selling the popcorn, but everybody else. So if somebody were to collapse anywhere in the stadium, we could quickly get through the communication system, a call, hey, somebody fell down in zone, row this, zone A, whatever, and then our pre-hospital providers could like focus it really in quickly. So um, that was been really helpful. But early on, we didn't have as robust a communication system, so we had some times where people had collapsed and we didn't know about it, and then they might have been down for too long. So that was kind of then trying to like find them and get them out through a crowded environment, like on a backboard, where people sort of crowded around, and we were trying to prevent that. Um, and so that was kind of a nightmare too. I'd say,
Unfortunately,
yeah, I
there
would say
can be
another one is
nightmares.
trying to get, like one thing we've been doing in Worcester is we've been trying to like get promoters and people, these event organizers or people that run these large stadiums. Like for instance, in Worcester, there's a very large indoor stadium that has a lot of concerts and events. Um, they don't have any. Their entire medical plan is they have an ambulance sitting outside of a venue, um, and it's up to whoever's coming in to the venue to say, you know what, I think we should have an ambulance. I'll pay for that. But I'd say there's no rules in many states. There's no rules about what needs to be in place medically as a bare minimum. And for instance, there's another place that has a lot of heavy metal bands and mosh pits and things like that. And I've talked to the promoter, and he's not medical, and he's like, well, if I feel like they need it, I'll have an ambulance outside. Otherwise, we just call 911. Um, and people just get away with that, but then people can get injured because they don't have a communication network. They don't have, you know, there's no like healthcare on scene. There's nothing.
Wow, that makes things difficult. You always need a plan. Um,
Yeah.
what advice can you give to frontline workers to help make patrons as safe as possible from a medical perspective?
Um, well, I guess the first one is good communication. So if you are you're dialed in, you've on the radio system, know how to use proper radio language so you don't step on other people talking, use the right radio channels and that kind of thing. But then if you see somebody collapse or go down, and you can immediately make the phone call to bump it up a level to get get the paramedics over there as quickly as possible, or the EMTs if it's first responders, because not every event has physicians. There are good studies that show that physicians on scene at large events really reduce the amount of people that have to leave to go get treatment elsewhere. They can be treated on site and go back to the game or the concert or whatever. Sometimes they just need some hydration and they go back. They don't need to go to the ER. But for smaller events, they don't have that kind of thing. It's really just paramedics and EMTs. But for everybody there, good communication. Keep your eyes open for like any kind of problems, especially like minor league baseball games. Let's say that don't Major League Baseball games. definitely have more of a robust communication system. But minor league games, people can hit with foul balls just as easily, but not, and they don't have as much communication system. So we really rely on everybody who's working that event to keep their eyes open for anything that's happening. Um, and then really, it's just if you are first on scene, just basic first aid. Try to keep the crowd away. If somebody's knocked unconscious, make sure they're breathing. Sort of we call it the ABCs: airway, breathing, and circulation. Hopefully, you won't get that if you're really a first responder and you're not medically trained. You won't have to do as much of that because the other teams will come in really quick.
So you gave a couple good points there about communication and understanding that there's a plan and safety for those around as well, and to check for ABC and things like that. Is there anything else that you can think about for frontline people, like strategies that they could undertake to help a patron who might be in distress?
Mm. Well, I think that's one good point you raised is the idea of the plan. Every event should have some kind of action plan, right? A medical action plan is just one part of it, and then as you break that down, part of it for the people that are sort of on the front lines there is going to be like a briefing of what to expect, like what are the dangers that could occur, so you sort of knows that you kind of are aware of the hazards ahead of time to some degree, and then you know what to look out for. So sort of hazard vulnerability analysis, like where are we weak? What do we have to worry about? If I'm do I have to worry about crowd, control, crowd crush? Do I have to worry about, flying objects, that kind of thing? If you're checking bags, what do I have to look out for? And all that sort of gets debriefed ahead of time through that action plan. And then on the frontline workers, for medical stuff, it's really just about making sure the scene is safe. Really, like not trying to reduce the amount of crowds there, because a lot of people are going to want to barge in and sort of help, but they don't really know what they're doing. You want to prevent not everybody who says they're a doctor is really a doctor, or if they say they're a nurse is really a nurse. I'm being kind of cynical, but is sort of wait for the people on your team to arrive and kind of keep it safe.
Okay. Yeah, you got to watch out for those people that stay at a Holiday Inn Express and think that they are a doctor now. Yeah.
Right. Well, somebody will say, I'm a doctor, I can help, but their person's it's a radiologist. They never touched a patient in, like 20 years. So.
Mm-hmm. No, I get it. What can frontline folks do to help make your job easier? As the one that will often see them,
Right.
when they come in with the ambulance or stuff like this, what can be done to help you out?
Well, so I guess two things on the top of my head would be the idea of one is the communications network, and then two is is making sure the scene is helping sort of with crowd control is a major issue. So if the paramedics are coming in to get a patient, we had the one instance where we had a really hard time getting through the crowd of onlookers, and they were trying to get this really sick patient, and there was like this massive throng of people blocking the way, and we really had needed police there, really, or somebody to part the seas and let us through, kind of thing. So part of it's crowd control, good communication. I don't know. I can't. I think that's kind of the two main ones I can think of. Yeah.
How about documentation? Because if they see something in the area, for example, if they see a dead wasp or something else like that, and person
that's a
had
good
been
one.
stung.
Yeah. So like anything on scene that someone else might have missed, help point it out to whoever's some way of. I don't know if there's a way to document these kind of things, or at least point them out to the people who are coming on to see them, or to treat the patient and get them out of there.
Yes, if there's medical response team, because often stadiums, arenas will have EMTs or others that are
Right.
available, emergency management people that are going to be able to respond. So if you see anything, if you hear anything, like if one of the witnesses to the incident said, oh, they grabbed their chest, or they did this, or they
Right.
got hit by the foul ball, whatever it is, that they can communicate that. And that is not just saying like, wow, that's a great piece of information and forget about it. communicate
Right.
it down the chain of command, because that will end up being in the record somewhere
Right.
that
That's
you
a really
said
good
that.
point. And also, it made me think is really large events. Let's say you're at in a something big like the Olympics or something with a lot of people, like a big event. Um, it can be very hard to find people within an area. I mean, if you're at a stadium, you can always say, row this, section that. But if you're at like a really, there has to be a way to say we are in zone A, or in this area of the field, so people know where to go. Like some way it's mapped out ahead of time, so people aren't like stumbling around trying to find you. If you're just sitting there like waving your arms, but nobody knows where to go because there's like a million people there. It has to have some sort of like map ahead of time that everybody knows the same map of what to expect. This is the south lawn, this is the north lawn, this is whatever, kind of thing.
Yeah, oftentimes facilities designate people to go in to meet the ambulance or to meet this group or that group, whatever, and to shepherd them to the right location. But that is all part of communication, and
Right.
we need it for all facets of our job. Which leads me
Yeah.
to the final basic question: what last nuggets of wisdom would you like to share with the viewers if you had a chance to sit in front of them and to prepare them for the next event day? What would you try to tell them that would hopefully make your job easier? Or I don't want to put you out of business, but that hopefully that someone wouldn't have to go to the ER while attending the
Right, because
event.
I'd rather people stay and enjoy the event and not have to go to the ER and get back to the game if something minor. So I would say, well, as we talked about, one is good communication. Make sure that you have like if whatever group you're in, let's say you're an usher or even you're working at the food stations, you have a supervisor, so there's sort of a chain of command, so that you get a good briefing of your area of what you're controlling ahead of time, and so one, you sort of know the communication system, you know where your map is, you know what your job is, and then you sort of know how to get an emergency message up the chain really quickly, and then also how to identify where. So if paramedics or health responders are coming in, how to help them do their job, like keeping the area clear, identifying your location, um, just making it easy as possible to get somebody in and out as fast as possible. I was actually at a concert recently that where the somebody I was there as a guest, and somebody in the crowd passed out, and it was a big crowd, and the singer on the stage saw it. So she said, "Hey, everybody!" She stopped playing her music and made everybody like back away, so that the health providers could get in there and get the person out of there, which I thought was amazing. I'd never seen that before.
I've seen that at a number of concerts, and one of the things you're talking about with the communication is that most of the larger events and larger venues have a command center now. And you just got to make sure you communicate with them because they understand the chain of command.
Right.
They
Yeah.
understand who to contact, and normally you have firefighters, EMS, police, and those people within a command center so they can help do the job, which would allow you as the frontline staff person to be able to reassure the person who's in medical distress or whatever and their loved ones around them, and to try to
Right.
make sure there's no crowd congestion and stuff like that. But oftentimes it's just knowing that someone has contacted somebody else. So
Right.
reassure them, like, hey, I've reached out to the command center. They're calling 911. We're going to have this an ambulance here. We're going to have the people here
Right.
in probably, I've been told a minute, so just hang tight, and
You keep
what can I
people
do to make you
calm.
comfortable? And
Yeah, you keep people calm, and if it's like that day on that particular event was a hot day, and people had like cool rags on their head, and sort of basic kind of common sense stuff was really helpful.
mhm,
Um, Obviously, if somebody's bleeding, God forbid somebody's bleeding, you can put a bandage on it, put something
mhm.
cool on their head. There's all that sort of basic first aid, which is not a bad thing. You can know. My son just took a Red Cross first aid course, and they offer them everywhere. And that's not a bad thing to do. and just sort of have some basic knowledge of ABCs. You don't have to do anything like super dramatic. Um, and then that's basically it. Stay healthy yourself. If it's a hot place, the other thing is stay hydrated. Wear sunscreen, hat, so that you don't become a. You don't want to be if you're working. You don't want to become a patient. Is one thing, and then also I thought it was interesting. There was some studies looking at like communication in these really large events, and it looked at the idea of text messaging. It's kind of a simple idea, but text messaging versus a radio, and it was so loud nobody could hear themselves on the radio, and they all relied on text messages. So have some backup communication plan, I think, is a good idea.
No, that's a wonderful idea, and that's why at some concerts they use flashlights or other
Right.
communication tools that will alert people to potential problems because sometimes you cannot hear. It's so loud. I
Right.
definitely agree. All right, well, this has all been very helpful information. I really appreciate you, coming on to the do this video, and that hopefully this will help some people who might be facing some medical-related issues to be able to relax, take it easy, to know that there are solid people behind them that are going to be taking care of the people once they get to the hospitals and stuff like that, and that they have to take care of themselves as well. So if you're on the front line, don't become a victim yourself by not taking care of yourself. Drink, drink, drink. Make sure you sleep the night before, have comfortable clothing, comfortable shoes, all that kind of stuff, because it will pay off with you being in better shape yourself. So thank you very much, Dr. Milstein. I really appreciate it. And,
My pleasure. Thanks so much, Gil.
and as people say when I'm talking with them, they say, I hope I never have to see you. I hope none of the people that are watching this video ever have to see you except under
Okay.
social circumstances.
Yes. I always tell people I'd rather see you in the grocery store than in the ER. You know.
Makes sense.
Right.
All right. Well, thank you very much, and I really appreciate all your time. And that's it from the Crowd Management Doctor. Everyone, stay safe out there.
All right. Thank you.
Bye-bye.